Today topic of discussion osteoarthritis. What is osteoarthritis? Osteoarthritis is a chronic disease. It is a chronic disease affecting the joint. It is a chronic disease affecting joint characterized by degeneration of cartilage and associated joint structure changes. So how we can define it is a chronic arthropathy disease affecting in joint characterized by cartilage degeneration and associated joint structure change. So it will causes that structural changes of that joint also. Normally a joint aligned with hyaline, so it have hyaline cartilage. Normal joint having hyaline cartilage that help to reduce this friction between that bone. So what is the use of that hyaline cartilage? Reduced friction between the bone. Cartilage around 95% water and extracellular matrix. So 95% water and extracellular matrix and 5% chondrocytes is present. These chondrocytes which are the cell that secrete to maintaining that matrix in osteoarthritis. So these chondrocytes are the cell that secrete and maintaining that matrix. In osteoarthritis, this cartilage is damaged. This can be due to abnormal remodeling, abnormal tissue remodeling after an injury. So abnormal tissue remodeling after an injury. Second one is inflammatory mediator from that synovium was affecting that cartilage. So inflammatory mediator from that synovium affecting that cartilage. Then this defective cartilage metabolism. So these are the things. So abnormal remodeling post injury, then defective cartilage metabolism, then synovial inflammatory mediator release. All the things will cause us cartilage damage. Overall mechanism is thought to be due to chondrocyte stimulate to repair that cartilage. So overall mechanism is thought to be due to chondrocyte stimulated to repair that cartilage. So they produced this proteoglycan and collagen, which are building block of that cartilage. So this one will secrete produce proteoglycan and collagens, which are building block of cartilage. However, their stimulation also causes them to secrete enzyme like matrix metalloprotein. Stimulation also causes them to secrete enzyme like matrix metalloprotein that break down the cartilage as well as inflammatory cytokines. That then causes further that one causes further stimulation of chondrocytes and perfectuation. Chondrocytes and perfectuations of the cycle. Eventually cartilage is broke down. Eventually that cartilage is broke down and the bone is exposed. So that bone become exposed. So bone exposed becoming sclerotic and causing osteophyte formation is an attempt to stabilize that joint. The ligament and the tendons surrounding the joint become stiff and can predispose to the tendinopathy and contractures. And muscle can waste and reduce that stability of the joint. So bone expand, subchondral sclerosis and osteophytes formation attempt to stabilize the joint. Surrounding ligament and tendons become stiff and can predispose tendinopathy or contractures. Muscle can waste and reduce the stability of that joint. So this is all about pathophysiology of osteoarthritis. Next is sign and symptoms. Pain is the most common symptoms, usually with gradual onset. This often work with weight bearing and is relieved by rest. However, with progression, it can become constant. It is not commonly present overnight. Unless in advanced stage, stiffness is the common. Stiffness is the common on waking or after inactivity. But it usually improved with movement. So this one improved with movement and last under 30 minutes. Then cryptitis or grading sensation can be developed. Any joint can be affected. The most common bones are this distal and proximal phalanges. So this one is this part is the distal phalanges. This second one, this one is the proximal phalangeal. So this one, any joint can affected. That most common is distal phalangeal and proximal phalangeal. Distal and proximal interphalangeal joint is mostly affected. Bony enlargement will happen. So here a bony enlargement will happen. This one name is called as Pouchard node. Okay, Pouchard nodes. In proximal part, bone enlargement name is called as Pouchard nodes. In distal part means this one name is called as Herbert-Den's nodes. So Pouchard nodes in proximal below. This one is the mnemonic. Then Herbert-Den nodes from Hayden, HH. So this is the things. Proximal affected means enlargement means Pouchard nodes. Distal means Herbert-Den nodes. The thumb carbo-metacarpal joint. Carbo-metacarpal joint is also commonly affected, particularly causing pain and difficulty with grasping, as are the cervical and lumbar vertebrae. So this one, the thumb carbo-metacarpal joint commonly affected and causing pain and difficulty with grasping, as the cervix and lumbar vertebrae, which can some instance lead to spinal stenosis. It leads to spinal stenosis. So lumbar stenosis particularly can manifest at neurological claudication, that spinal involvement. This one name is called as neurological claudication, meaning intermittent leg discomfort. As a result of nerve compression, others include the first metatarsal phalangeal joint of that foot. So as a result, the nerve compressions. Others include first metatarsal phalangeal joint of that foot. The hip is most commonly in weight bearing or rotation, such as when putting on shocks. The pain can also coming to be referred to as groin or knee arthritis. Hip mostly affected, knee also affected, that spinal also affected, thumb also affected, this one fingers, distal phalanges, proximal, then pain in leg. Next, what are the causes? Primary cause of that osteoarthritis is unknown, but this one multiple joint affected. So this one is the generalized osteoarthritis. The secondary osteoarthritis can be the result of condition that alter that joint structure or cartilage microenvironment. Example including congenital joint abnormalities, significant trauma, and other osteopathies like rheumatoid arthritis, gout, psoriatic arthritis, as well metabolic causes like Wilson disease or hemochromatosis. These are the common causes. Okay, these are the things secondary causes. Then it is more common in female than male, become more prevalent as age increased, with 45% of that old people, 45% of people covers that over 70 years. Then having radiological evidence of it. Other risk factors including family history, obesity, then repeated excessive abnormal loading such as this one professional sports or occupational and physical inactivity has also been shown to be the risk factors. So these are the risk factor. Primary reason unknown, secondary reason, these are the things. And diagnosis, most commonly the clinical with imaging done to support the diagnosis. A clinical diagnosis can be considered if there is activity related to joint pain or no morning stiffness, or if there is a duration of loss less than 30 minutes or age above 45 years. Commonly finding x-rays. So x-rays here, this is we can find out 4 things. Loss of joint space, osteophyte formation, osteophyte inside bone, that fluid will filled, that one is the osteophyte. Then subchondral cyst, extra growth like that cyst in between 2 bone, like that extra bone formation like that. Then subchondral sclerosis. These are the things we find out in this x-ray. Then blood test is not required because this one in case of unsuddenly can be used to raise the inflammatory marker. Presence of other marker like rheumatoid factors, antibodies may point to an altered diagnosis like rheumatoid arthritis. So finally, treatment primary aim aimed at reducing pain and improving function. Why we are using reducing pain and maximizing that function? First we can 3 set they classified treatment. First non-pharmacological, second one is pharmacological, then surgery. So non-pharmacological, this one is the physiotherapy. Okay, management with physiotherapy to maintaining that range of motion and improve that ability of the tendons and muscles to deal with joint stress. Then during motion or immobilization can promote contraction and so is discouraged, and weight loss can also reduce the load on joint and can slow the progressions of disease. So weight loss, activity modification, supports, knee freezes or walking aids can be beneficial in some cases. So these are the things pharmacological. Next one is pharmacological treatment is often used for along with physiotherapy, a non-steroidal anti-inflammatory drugs with topical agent being preferred. Then paracetamol is the most common first line agent, though paracetamol is some studies has shown limit benefit. Then topical capsaicin is an option but regularly given. Then Dilocedin also there are using. Then corticosteroid joint injection. In the case of surgery, surgical option is usually explored after non-surgical therapy have failed can include joint replacement or osteotomies. So in this video, osteoarthritis causes, then pathophysiology, sign and symptoms, treatment, three-way, non-pharmacological, pharmacological and surgery. Thanks for watching.